With some exclusive details. John, good morning.
Rudy Giuliani at a town meeting here in Rochester, New Hampshire, is going to lay out the elements of his plan. He had another town meeting yesterday in Laconia. We caught up with him and sat down afterwards. He previewed some of the elements. The key to what he wants to do is to build up the individual marketplace using a tax credit, same kind President Bush proposed earlier this year. Congress hasn't acted upon. But Rudy Giuliani avoids the mandate that his Republican rival Mitt Romney proposed in Massachusetts a couple of years ago. And unlike the Democrats, he does not promise that his plan is going to cover all of the 45 million Americans now uninsured.
It's important to get that number down. It may be possible to get it down to zero. It may not be possible to get it down to zero.
Now, Giuliani also waded into the controversy now brewing in Washington over children's health care. President Bush has threatened to veto what the Democrats have proposed to dramatically expand that program, saying it would lead to single payer. Giuliani condemned socialized medicine, and he said Bush is right.
If, in fact, the analysis is correct, and we have to see the final version, if it, in fact, is going to move children away from private insurance to government-controlled health care, I think then you have to veto it.
Now, Giuliani, the former mayor of New York, did not seem overly concerned, Carl, about the stock market turbulence of recent days. He said the economic fundamentals were good, but he linked what's been going on Wall Street to all the talk among Democrats about raising taxes.
I think this fight over taxes is probably affecting the market. There's no stability here. You can't predict 3 or 4 years ahead.
Now, let's keep in mind what Giuliani's overall goal is. Remember, Carl, he's somebody who is weak among social conservatives because he favors abortion rights. That means he really has to take the lead among economic conservatives in this race, and they're important in New Hampshire more than they are in a lot of the other early states, Carl.
John, by saying that maybe not everyone gets covered, how big of a target does that put on his back when it comes to debating the Democrats next year, let's say?
Well, you're exactly right with that point. When we get to a general election, the idea that he concedes he may not cover everybody, the idea that he says we ought to veto the expansion of children's health care, all of those are things that have the potential for putting him on the defensive. But what he's arguing for is that Americans really don't want, as they did early in the Clinton administration in 1993, they really don't want to go to a single-payer system, that they're concerned about overturning the private arrangements they already have. But it's a foreshadowing of the intense health care debate we're going to have in the campaign and in 2009 after we get a new president.
Interesting stuff. John, bringing it to us first. Thank you, John. John Harwood joined us from Rochester, New Hampshire.